great pleasure that today I get to introduce you to a wonderful woman, Amber Roberts. Amber. Just before I tell you about who Amber and what she does, I came across Amber in an environment that I think a lot of people can relate to, which is our children go to the same kindergarten, and we were at one of the numerous birthday parties that we go to, and I remember we were sitting down and we were talking about, like, you know, just the normal sort of get to know people chit chat, and it was like, what do you do, and etc. And Amber sort of started talking about a little bit about her background in pharmacy and owning some pharmacies and working in the sort of that, would you call it sciences? Is science?
Yeah. In the health space.
In the health space.
Yeah.
And I remember just sitting there thinking, she sounds really interesting. Her story sounds really interesting. And so I went home that night and I did do a bit of a Google stalk on you and came up with some wonderful little bits of information. So Amber and her husband, who's also a pharmacist, own 5 pharmacies across the state. So you've got Snug, Campbelltown, you've got 2 pharmacies in Burnie and 1 in Wynyard.
Yes.
And you're currently working with KP Health as a consultant in providing healthcare consulting. And Amber was just sort of explaining to me that what that means in normal life, I guess, is that if people, the hospitals might be looking to try and reduce the number of infections in the hospital. That's something that you've helped with before, and also, you know, things such as helping people who have diabetes, how to transition onto their insulin medicine correctly and I guess efficiently.
Yes.
Yep. Is some of the sort of work that you worked on before. And previous to that, you were at the Department of Health and Human Services in a senior management role, working with. Can you tell me what it was? The highly specialised drugs.
Yes, that was part of the role. So the role included how the state purchased drugs, the rules around access for drugs, and how to use medications in a safest, most effective way.
Yep.
Yeah, and also around how pharmacists interact with healthcare professionals and patients.
Because I guess the thing that people don't think about too much is that if you go into a hospital environment, pharmacy plays such a big role in the treatment of the patient. You see the doc. You don't have the pharmacist coming to the bedside necessarily. My understanding is being,
not always.
But
no.
you normally see the doctors and the nurses. But you know, behind that, just giving out the medicine and working out all that is the pharmacy people.
That was actually a huge part of my role. So one of the programs that we worked on whilst I was in the role, and was the major project at the time, it was called Pharmaceutical Reform, and that really involved making sure that pharmacists were interacting with patients at particularly crucial times, times that we know when medication harm can occur. So it was already happening in the state, but we needed it to happen in a really consistent, uniform way.
Yeah.
So to try and catch those times where medication error could really occur.
Yeah.
And so part of the program was making sure there were enough pharmacists across state hospitals, making sure they were particularly targeting those activities that we knew would help people the most. So yeah, that's something that I'm very, very passionate about.
And I suspect perhaps had something to do with winning or being awarded the 2015 Society of Hospital Pharmacists of Australia Medal of Merit. Was that to do with that sort of that
That
work?
was certainly part of it. Yeah. That was a huge honour. The biggest honour with that award was that my colleagues actually nominated me for the award, and that was a really big deal because they were there on the journey.
Yep.
The journey was theirs as well. So for them to choose me and put my name forward was really lovely.
On the website, so that recognises outstanding recent contribution and exemplary effort relating to hospital pharmacy practice. Well done.
Thank you.
Talk a bit about pharmacy. Like, you did a Bachelor of Pharmacy. what was the interest for you in that?
It's funny, I knew really early on that I wanted to be a pharmacist, and I did some work experience, and we had a fantastic work experience placement teacher, and I did some work experience at the old Burnie Hospital, and the pharmacists there were just so, they were passionate about what they were doing, and I knew at that time that's what I wanted to do. So it was a really easy decision for me.
So you said you saw that they were passionate about what they were doing. What part of it were they passionate about? Was it do you think that they, and yourself now, it's that feeling of helping somebody through applying the right medications, or is it the challenge of getting the medicines right, that kind of mathematical, kind of systematic approach to it? Like, which part of it really?
It's a bit of both.
Yeah, okay.
It's a bit of both. And when you meet pharmacists, I tend to find that there are those that help by being very detailed and specific, and then there are those that help by caring and finding problems to issues to problems, not problems to issues.
Yeah.
And so either way is very effective. So it just depends how your personality is driven, I think.
And is that where you met your husband? Because he's a pharmacist too.
He is. So we actually have mutual friends, but we met properly at university.
Yeah, okay, nice. And so then, when you left university, you did your you said you did your internship up at Burnie. How did you then, the evolution happen into working in the public service, or actually purchasing pharmacies?
Yes.
Yeah, how does that happen? Like, did you sit down at a table one day with your husband and go, well, I think we should buy a pharmacy? Suddenly now we've got 5. Like, how does that happen?
Well, when we left university, we both did our internship at the hospital.
Yeah.
Sasha was really, that's my husband, was really clear early on that he wanted to be in the community pharmacy space, and he wanted to be a business owner.
Yeah.
And I was very clear that I wanted to be in the hospital pharmacy space and be involved in that aspect of pharmacy. But we didn't have much experience, just first year out. So after the internship, we went to Queensland and we worked for community pharmacy owners up in Queensland. And we were really fortunate in that we got to work for people who were quite cutting edge, who owned multiple pharmacies and who were really progressive. So firstly, we went to quite a rural place, and that was interesting because most of our pharmacies are rural pharmacies now. So we're really influenced by how much you can impact care and impact a community in a rural area. And then we spent time in a city area, and we saw the systems and efficiencies and ways of being able to provide a service, an affordable service. Yeah. So I feel like we got a really nice apprenticeship in both. Yeah. And then when we came back, Sasha pursued purchasing pharmacy, and I pursued working in hospital pharmacy again. So we've always had interest in both, but we've each tended to go on separate paths, which has worked really well. Yeah. Spirituality is really important to my family, and has become more and more so over the years, and that's mainly with my mum's leadership. So that figured through my childhood and has come through my, it's a big part of me today as well. Yeah.
If you were at Marist Catholic school and you've got Olympia at a Quaker school, was your mother Quaker, or was she?
Neither.
Okay.
Yeah.
Yeah. Okay.
So well, that's not correct. We started off Catholic. Mum was Catholic, and she got a little bit disillusioned, and so she started searching for another form of Christian expression, and she found that with a Baptist church, and so we got very involved in the Baptist church. I now attend an apostolic church, so
I don't even know what that means. I'm so sorry. I don't. Can you, Baptist, I can wrap my head around, but
yeah.
So what was the other one?
It's just, they're very, I suppose what I'm trying to say is, for me, denomination isn't very important. Christianity is, but what branch of Christianity someone is engaging with, I think is secondary to that.
Sure.
Olympia goes to a Quaker school, although I don't go to a Quaker church, I don't identify as Quaker, but I like that she gets those Christian values, even though it's a different expression. When I was young, I had a naive idea about management being always knowing what had to be done, always being sure of what had to be done, and sort of this idea of power instilled into a role. And you soon learn as you grow and you mature that that's not how it is at all, and that you're surrounded by a group of people with skills and a common goal, and as a group you find an answer, and as a group you keep refining and honing that answer, and nobody holds power. It's a collective power, but we each hold influence. And what I really, really have enjoyed during my time in the department is seeing how individuals can have influence, and significant influence, without necessarily holding the title.
Yeah.
And that's powerful.
And so what do you think feeds the influence, for lack of a better term? Like, what do you think is, from your experience, the aspect that makes that person, regardless of seniority or level, but they've got the influence? Like, what do you think is the key trait? Or
I think for it to be sustainable and effective, it has to come from a genuine place.
Yeah.
You can't pretend to care about things you don't care about. And you can't be consistently diligent on something unless you firmly believe it's what you should be doing. In some situations, some women specifically choose not to be in positions of leadership because of the perception that you have to exhibit masculine behaviours to be a good leader. And I've certainly found that not to be the case, that there is space for masculine strength leadership, and there is space for feminine strength leadership. I've actually seen really, really good partnerships where men and women have put aside their roles and egos and worked together using this complementary skill set. So I think until we get to a situation where we see leadership in the collaboration that it is, rather than this, this sole person who knows all and conquers all, once we get real about what leadership really is, a collaboration, a shared responsibility, a collective listening, those sorts of things, which are really feminine traits, then I think there's also going to be some women aren't going to feel true to themselves, putting themselves into roles that they believe aren't them.
It's an interesting scenario where, for a long time, I guess, women have been told, we need to fix you, we need to give you more training, you need to get the right attitude, you need to be more assertive in the workplace, and things like that. And I certainly, in previous attempts of applying in roles, have received feedback that I was being a little bit too assertive and a little bit too, I guess, to use the word person, maybe arrogant. But it was coming from a place of, I've been told I need to be strong. I need to say I can do this, and I've done this, and then I agree with you too. Like, you're sort of putting yourself in a scenario where that's not technically your
authentic self,
and how you would normally be, but you're doing it because you're trying to compete in a way with the rest of the people applying for these positions, and so you put on this going in And if, you know, in most recently, and only in like the last few months, I've had some feedback saying, you know, you were a little bit too assertive. And like, okay, now I'm starting to get a little bit confused about what am I supposed to do? Like, if I'm applying for a job, am I supposed to be, being strong about my skills, or? And so I think there's still work to be done on both sides of that equation around teaching the women to be confident and assertive and knowing that they can actually do these roles, which, but also on the other side of the people who are doing the recruiting to understand that it is okay for them not to need to do that, because that's actually not their authentic self and what they would bring. Would you say that you're happy?
Yes, I would say that I'm happy. I don't ever really think back to a time and say that I was unhappy or wholly unhappy. So I've always felt happy in different places, in different stages. It'd be pretty rare. It had to be a pretty yucky event where you would not be happy for a period of time. But yeah, I've always been fortunate. I feel like happiness follows me.
What about contentment?
Contentment's harder. Yeah, I've been moving into that space. It definitely didn't exist in my younger years. I think ambition and contentment don't sit in the same room well. Until you learn it's not about you. It's hard to explain. The things that you're passionate about, I think when I was younger I started off being passionate about achieving those things myself. And then as time moved on, I've become more passionate about seeing those things achieved, and I may have a role in that, or I may influence that. But it's not necessary. It doesn't have to be all about me. And that's been really liberating, because when you feel it rests on you, when you feel it's all about you, there's very little space for contentment. One thing that is interesting when I go into people's homes and I do these home medication reviews that I mentioned earlier, is that I speak to people, and they're often very elderly people, and they're often really keen to tell you about their lives and what's important to them. And they hardly ever talk about what they're doing, what they do from day to day, who they are. They talk about who they are, not what they do.
Yeah.
And that's really interesting, because as a younger person, we're very much defined about what we do. You know, people say, what do you do? And this is what I do. But the people later on in their lives appear to be far more interested in who they are themselves and who they are in relation to other people. So they're very, very clear on the importance of family or friends or pets.
Yeah.
Accomplishments are important to them, but get very little airtime.
Yeah.
And that's been a real revelation to me, because what you do right here, right now matters, but maybe not as much as you think it's going to matter. There are other things that are going to matter forever. If you take all your opportunities and you work diligently, and there is, some aspect of luck along the way, then that may be successful. Is it successful just because everybody knows about it? No. Or because you're considered a certain person because of what you do? No, it's successful if you've reached those goals. So for me, there are, I suppose, ideas of what work success looks like, and that is actually being able to influence outcomes. And so previously I got to do that in the public sector. Now I get to influence it outside of that sphere, and it's different type of influence, and that's really exciting, learning about that. But when I think of success holistically, it's far more than that. And there is value in excelling at one thing. I think there's more value in roundedness. And it's hard. It's that balance of achieving what you want to achieve on multiple fronts of your life, not just in one area. I often think about people who are particularly gifted and brilliant at one thing. That's wonderful. But it's still not easy to live a full life if your gifting's in just one area. The idea is to strive to be rounded in the way that you live. We actually own five. They're just the ones that are in my name.
Oh, what are the other ones?
So there are two in Burnie.
Two.
And one in Wynyard.
Oh, actually, I remember you saying Wynyard at one point.
Yeah, sorry.
No.
It's just my husband will be.
We only five.
And everyone will be like, she's forgotten some of our pharmacies.